bone loss, periodontal disease, and dental implant failure. All of these are associated with these bacterial pathogens, an unhealthy mouth, and these microorganisms initiate and or worsen these processes. So gum disease is the initial presentation of periodontal disease. Gums that bleed when you use a toothpick or brush your teeth, or perhaps even when you're eating something. This is not normal. And that gum disease, which is stage 1, continues to progress all the way up until the tissue around the tooth, the tissue up deeper into the tissue and to the bone, and even the health of the bone, resulting in bone loss. So bone loss and oftentimes loss of teeth is the 4th stage or final stage of periodontal disease. 95% of those with diabetes have gum disease, and 90% of all of us, the entire population, has gum disease. So again, if your teeth hurt, if your gums bleed with anything, even a soft pick, dental floss, even when you eat, even when you use a soft toothbrush and just brush your teeth, if you sense the taste of blood or if you're spitting blood into the sink, this is periodontal disease. At a minimum, it's gum disease and needs to be treated. Remember, we've said that 95% of those with diabetes have gum disease, and 90% of all of us, the general population, has gum disease. And this increases our risk of bone loss, of worsening periodontal disease, and even dental implant failure, because as I've just described, it can impact the bone. So this one is definitely a reason, whether you get the saliva test or not, you need to go to the dentist and dental hygienist as soon as you can if you're noticing bleeding or unhealthy gums. But even if you're not noticing bleeding or unhealthy gums, because of the prevalence of gum disease, I highly recommend that you perform a screening test, the spit test, on your saliva, because any worsening makes it even easier for these pathogens to get into your bloodstream and affect your entire body. So order the spit test today, but hurry and order it if you notice any unhealthy gums, any pain in your mouth, any bleeding of the gums. You need a saliva test to at least screen and see what's going on.